And now in this session, we're going for nursing. And then we are very delighted to have a Dr. Chen Jizhong. And he's the DOM in Tuen Mun Hospital, and he got lots of experience on managing nurses and working with nurses. And he also is a chairman of the nursing associations. So he know what the nurse needs, okay, for what do we need what nurse do we need and how can we train the future nurses. So I would like to invite Dr. Chen Jizhong and to give us his thoughts on the topic of development of emergency nursing in Hong Kong, future plans. Dr. Chen, please. Hello. So we're going to show Dr. Chen's presentation.
Good morning. Thank you, Chairperson's kind introduction to me. And I would like to also thank the A&E Medicine Academy students' invitation to me to allow me this great chance to have sharing with you all. Today, my topic is the development of emergency nursing in Hong Kong, our future plan. Since I am the president of the Hong Kong College of Emergency Nursing, Hong Kong CN, so that I would like to use the perspectives of Hong Kong CN to share with you all the developments of emergency nursing in Hong Kong. Hong Kong CN was established on 16 March 2011, and it is one of the 14 institutional members of the Hong Kong Academy of Nursing, HKAN. In 2012, we have our first conferment, a total of 107 emergency nursing fellowship members from Hong Kong AN under the grandfathering scheme. Then, what was the grandfathering scheme? At that time, if emergency nurses working more than 15 years and they could demonstrate significant contribution to emergency nursing, then we can apply the fellowship under the HKAN. There are about 7 areas to be the perspective of Hong Kong CN to develop emergency nursing in Hong Kong. The first, leadership. The second, setting advanced nursing practice standards. The third, training and development of emergency nurses. And also the research and evidence-based practice. The fifth, the smart, innovative A&E. The sixth, we strive for attaining statutory status for advanced practice nurses. And also, we also would like to collaborate with mainland China and enhance chance for our nurses to have international exposure. The first, the leadership. Okay, as you know, the Hong Kong CN is a body to ensure the advanced nursing practice. We aimed to promote the public by improving the quality of healthcare and emergency service to the community. Before the COVID-19, every year we conduct the first aid training to the secondary school, and also the HKAN will hold health carnival activities every year. At that time, we would provide the first aid booth and also ensure the participant safety during the activities. And also, we also promote the advancement of knowledge of science and art of nursing, and to also promote the integrity, ethical conduct, and standards in the practice of emergency nursing. We also foster the development of the emergency care education, facilitate the exchange of information and ideas in nursing and methods concerning the health of the public. And we will collaborate activities with other organizations to improve emergency care. And the second, we set standard of advanced nursing practice. The HKAN is an independent institution responsible for the regulation of advanced nursing practice for 14 academic colleges, including Hong Kong CN. We focus on the level 6 to 8, according to the 9 levels of key elements of the career framework differentiated for healthcare workers. Now, I would like to share more about the detail of the competence in the level 6 to 8. In level 6, that means the senior practitioner level. Nurses at that level should require a critical understanding of detailed theoretical and practical knowledge, and also a specialist in that kind in A&D in any area, and also they have the management and leadership responsibilities. Nurses at level 7 should obtain the critical awareness of knowledge skill, and also in that field and need to interface between different fields. Then this is the advanced practitioner level. Nurses at level 8 should be a consultant level. Nurses at that level should have a career framework requiring high specialized knowledge, some of which is at the forefront of the knowledge in that field of work, and they should be strong in the research and evidence-based practice, and they also a leader with a strong responsibility and ability to do research. Now, I would like to share the training and development of emergency nurses in Hong Kong. The first training in Hong Kong was in 1893, and the Leverstow Hospital developed the first hospital-based trainings for female nurses. After 28 years, then 1921, then they also developed trained male nurses. Okay, but of course they didn't have designated specialized trainings in the emergency nursing until 1987. Before the provision service of the hospital authority, the hospital services department, one committee named the Continuous Nursing Education Committee, they set the standard aimed to ensure trained about 30% of nurses working in A&D departments and should be equipped with the competence in the specialty level. But at that years, only one nurses received the emergency nursing special training, so that at that years, 1987, the government sponsored nurses to have overseas trainings, 8 to UK and 1 to Australia. Few years later, and in 1994, then the HA developed their own local training courses in emergency nursing. Okay, then 1 year later, they also suspended the overseas training. The post-registration certificate course PLCC in emergency nursing is a critical step and milestone for training emergency nurses in Hong Kong. The course were jointly organized by 4 organizations: the Hospital Authority Coordinating Committee (A&E), the HA Institute of Advanced Nursing Study, the Hong Kong Society for Emergency Medicine and Surgery, and also the Hong Kong Emergency Nurses Association. They aimed to develop the emergency nurse competence to a high level, and also ensure all emergency nurses should obtain skill and knowledge in the analysis and critical awareness about the theory and practice. Also, evidence-based practice is also a key areas to be developed for emergency nurses. Of course, since 1991, we have many courses such as ACLS, PALS, basic trauma life support, and trauma nursing course. Then those courses are very essential for emergency nurses to equip their basic to advanced skill to ensure quality of standard to our patients in A department. Until 2017, the HKAN developed a pathway for nurses to membership and fellowship level. They developed this pathway with a structured course, and they set the standard to ensure the nurses to the fellowship level. At that year, 2017, there were 3 emergency nurses apply the course and obtain this earned fellowship qualification. A total of 70 steps along the pathway developed for the standard to train the nurses from the associate member, ordinary member, and to the fellowship membership level. Okay, some steps are crucial, are very essential steps. I would like to name some. We need to pass the complete the 500 theoretical hours with around how to say, among the 500 theoretical hours should be have 300 hours at postgrad level. Also need to complete 500 hours of the guided clinical practice under the guidance of the mentor, and also need to pass the certificate examination. In the examination, there are 150 questions, and the candidate should get past over 105 questions, then get the pass in the certificate examination. And also after that, then also the candidate also need to pass through the exit assessment program, do the research, and also demonstrate the significant contribution to the nursing community. Then candidate at that time can apply for fellowship membership. Okay. In 2018, we have 3 pioneer earned member. That means after the examination. And for, as of today, we have 176 fellow member. There are 13 are earned fellowship member, and we have 8 ordinary members and also 25 associate members. That means the mentee. As you all know that the research and evidence practice is very essential for our healthcare services. Okay, and some author, the team stated that nursing research should become an essential component of nursing curriculum, have a tremendous influence on current and future of nursing care, promote optimum nursing care, and contribute a variety of skill and experience to the science of nursing care. But there are also many difficulties and barriers for nurses to do research in any department. There are many reasons. Some studies say that the lack of sufficient time for reading the studies, to implement the new ideas, or lack of facilities to implement the idea and also do the research and conduct the study. And also lack of sufficiency, familiarity with research methods, and the experience in doing the research, and also don't know how to publish. But according to my experience, I agree their statements. Okay, I experienced that there are many barriers to conducting nursing research in ANE. The main reasons we are, as you know, that all emergency nurses are highly occupied by their daily work. They are all are very busy, are fatigued after one day work. We don't have enough time. We don't have adequate motivation and incentive to do research, and also some may think that they don't have adequate skill and knowledge to do the research, and also no one push them. We don't have the research facilitator, and no one support them to do research in the BCANE environment. In view of this, last year, I set some strategy to promote the research in ANE in my department. Firstly, we should get full support from our department to gain support from the department management committee. I identified research facilitator to invite nurses to join the group to cultivate or nurture a research culture and norm in my department, and also I initiate and facilitate nursing research implementation. And it's good to invite nurses who are studying the master program, because we can have a job win-win situation. We can invite them to join a research group. Then we can collaborate with university and other healthcare institutes to do research in the departments. Then this is a good incentive to invite them to do research in my department. Of course, if they can publish the paper, then they will have more satisfaction about doing research in our department. smart and innovative A&Es. And the direction of the smart hospital in and IT innovation are evolving in AE&E. As you know that, the EAED are already kicked off in many A&E to promote communication, the paper-led A&E with cost system and real-time clinical data facilitate patient assessment, operation treatment. In my hospital, we also developed the e-research program. We pilot in my hospital, the Tuen Mun Hospital, since December 2020 to enhance documentation, medication safety, and the resuscitation patient safety. Okay. And then also the e-vital system we pilot in Teaching Hospital to enhance vital signs efficiency, accuracy, and completeness of clinical documentation. And I think you all agree the digital technologies can enable improvement in patient quality and safety, and also enhance the clinical efficacy and effective communication. So that I strongly believe that emergency nurse need to have an open mind, be open mind, and be prepared to facilitate the direction to go smart in future. This is our true love to develop our emergency nursing in Hong Kong. Strive for attaining statutory status for advanced practice nurses. Our seniors worked very hard over the past 10 years for this direction, but now we are still on the road. Luckily, the Food and Health Bureau invites Nursing Council of Hong Kong, NC Hong Kong, in 2018 to formulate a voluntary scheme on advanced and specialized nursing practice. The HKAN and Hong Kong CN have been invited to formulate the relevant core competence for emergency care nursing in 2019. And they developed the application program. The application for recognition as advanced practice nurses, emergency care nurses have been accepted since 21 June 2021. There are two kind of standard before applying the registration. The first, they either obtain a registration master degree courses with a PLCC or who is a fellow of Hong Kong AN. After that, if they have 6 years post-registration experience and 4 years working in the AN department, then we can then they can apply the recognition. As at January 14, 2022, a total of 196 nurses are in the list of advanced nursing practice in emergency care nursing, and we strive for having statutory status for advanced emergency practice nurses, because this is a very crucial development in our near future. And there are 5 competency areas for the individual specialty. That means one of the emergency nurses by Nursing Council Hong Kong to set a standard for according to the core competencies of specialties. The first, the area 1, professional, legal, and ethical nursing practice. The second, health promotion and health education. Area 3, management and leadership. Area 4, evidence-based practice in research. And area 5, personal and professional development. Then this is the example that the HKAN work with the Hong Kong CN to develop the core competence of emergency nursing according to the voluntary scheme on advanced and specialized nursing practice. Okay, this is a sample. If you want to load detail, you can click the link and see more detail in the link. Then the standards have been already published in the website under the NC Hong Kong. The Nursing Council Hong Kong will have direction to review the specialty master program for the consideration of setting up a statutory registration system in the long run, so that Hong Kong CN work with the local university to develop advanced and specialized nursing core since 2021 and aim to develop high quality training at master level in Hong Kong, because we have no local postgrad courses in emergency nursing now. Okay. And Hong Kong CN also aims to facilitate their associate member to achieve relevant theoretical and guided clinical practice hours upon the pathway to membership and fellowship level. And one of the development of the emergency nurse should have a closely collaboration with mainland China and support them to have some emergency nursing training and conference in mainland China. And also encourage our members to have international exposure and connection. The Hong Kong CN supports HKAN conducted a recognition exercise for Guangzhou nurses for their advanced practice nurses. And Hong Kong CN also supported the HKAN to sign memorandum of understandings with the University of Newcastle in Australia and the McMaster University in Canada to promote advanced nursing practice. And also we actively supported and participated in the ISAM and ASAM. And also we supported our members actively to participate and present in the International Conference for Emergency Nurses in Australia. But of course now, since the COVID-19, then these activities have been suspended in these few years. And this is the example for our previous presentation and awards in the international conferences. Okay, the last few slides. Okay, I would like to share the concept or the definition of emergency nursing after the gaining some reflection from the COVID-19. In the literature, we find that some authors say that emergency nurses must be ready to treat a wide variety of illnesses or injury situations, ranging from a sore throat to a heart attack. I agree. Emergency nursing is a consistent nursing specialty, but we are also pediatric nurses, orthopedic nurses, neuroscience nurses, labor or delivery nurses, psychiatric nurses, you name it, we do it. I agree. I support this. Emergency nurses treat patients who are suffering from trauma, injury, or severe medical condition and require urgent treatment. Agree. But after last month, I have many reflections. Then, what will be an emergency nurse to be? My concept is simple. Although emergency department varies in shape, size, and technology, similarities in responsibilities exist. The primary responsibility to provide quality health care to patients, absolutely correct. Nurses' universal function as the responsibility of assisting the patient in covering their basic needs. And also emergency nurse is a specialty within the field of professional of nursing focused on the care of the patient. So that with repeatedly, effective thinking of the concept of emergency nurse, my concept is simple. Emergency nurses is not only focused on the advanced nursing practice, the advanced skill and knowledge, but also the basic needs and care of patient. The basic needs and care that means food or shelter. Okay, because last month in my department, we experienced over hundreds of patients, the COVID-19 patients, waiting in our department, waiting for admission, and they didn't only waiting for the advanced treatment, but they also waiting for the food and shelter. Okay, so that we should bear in mind that basic needs and care are also very important to our patient in A&E department. Thank you very much.
Thank you very much for Dr. Che Zhong's excellent presentations. Then we,
introduction to me, and I would like to also thank the A&E Medicine Academy students' invitation to me to allow me this great chance. Okay, sorry.
Okay, thank you very much, Dr. Chong Zizong, excellent presentation. And we learned a lot from his talks about the Hong Kong emergency nursing development, the history and the future direction. And also we know more what emergency nursing have been taught and then what level do they have. Is there any question you would like to ask Dr. Chong Zizong? I got some question on my hand, even not on the floor, because it will be difficult online to answer the questions on the floor. So, okay. So when I asked Dr. Chen, yes, what you say, we got advanced nurse practitioners, okay, and then we got fellowship. But the patient not only need advanced research technique, whatever, which is further development, but also need the daily basic nursing care, which is the backbone of a nurse, okay? We need to do the excellent care for our patients in daily practice, not only in the conference, in the papers, okay? Because although we both publish, but the most important is that we hope the basic nursing care did well. So, but what I think is that when we, the nurses, were trained a lot of skills and knowledge, but in the current situation, some of them need to there's a lot of the boundary. Okay, so you can't do this even you know that it should be done like this way because the guideline and policy which maybe made years ago, and then or at that time when they have lots of the boundaries, say nurse cannot do this, need to wait order, this one need the doctor's order. Even with some very simple assessment and tests, okay, which was done every day by nurse, still need to wait for the doctor's prescription. Is there any side and opinion you can advise us on these aspects?
Yeah, well, I think our what we call the advanced nursing practice, maybe we have to do more advanced. But maybe in the Western country, then nurses maybe can have a right to prescribe some drugs or some, of course, according to protocol. But in Hong Kong, then maybe we still have think more to see whether our nurses can explain more in this nurse practitioner roles. Of course, maybe if we agree that, then we need to discuss with the governments to have some changes in the ordinance or in the law to allow nurses to do this prescription rights. But first of all, as I just mentioned, that our senior nurses work many years to try to have some statutory status in our fellowship program, but now we are still on the road. Then we hope the government or all professionals can support our nursing, our emergency nurses to have this statutory status in Hong Kong. Okay.
Thank you, Dr. Chen Jizhong. Okay. Thank you. So I will go to next topic. Okay.